my grandmother in 2020. She was one of the warmest, kindest people I ever knew. The kind of person who made you feel safe just by being there. But the hardest part wasn't just the illness. It was helplessness. It was knowing that the care she needed existed, just not where she lived. And I kept wondering, how is that possible? This is my grandmother, and her story isn't just hers. It's the story of millions of people around the world, people who suffer not because the treatment doesn't exist, but because it's locked behind barriers they can't break through. Barriers of distance, of cost, of infrastructure, of simply being born on the wrong side of the map. She's not alone in this. Her smile hides a reality shared by far too many. People whose lives that are shaped not by the limits of medicine, but by the limits of access. When I look at her picture, I see global injustice. And it's something we can no longer ignore. Her story isn't just about loss. It's about something far more terrifying. That in our world today, you can have the money, the will to survive, and still not make it. Because if the nearest hospital is 6 hours away, if there is no ambulance, then even the best medicine in the world can arrive too late. And on the other side, you might live right next to a hospital. But if you can't afford the consultation, don't speak the language, or don't have the paperwork, then even standing in front of a hospital can feel like facing a locked door. And sometimes, it's not just about how far away you are or how much money you have. It's about something deeper, that the healthcare system in many places is built for some and not for all. For those who live in cities, who speak the language expected by the system, for those who fit the design, while many others are left waiting outside. When I look at for those who fit the design, health outcomes are shaped not just by the limits of medicine. They're shaped by the limits of access. But sometimes, what if the system doesn't have to be this way? What if we could design systems that reach everyone equally? Because system does work differently. Take polio, a disease that once paralyzed hundreds of thousands every year. Polio was beaten back because countries shared data openly and coordinated vaccine efforts globally, proving that when we break the wall and connect, we can beat even the toughest health challenges. In fact, since 1988, global polio cases have dropped by over 99%. That is the power of collaboration and proof that change is possible when we work together. But here's the thing. Polio was an exception and not the rule. Most health crises don't get that kind of global spotlight. Most communities don't get that level of support. Because while some parts of the world are sprinting into the future of medicine, others are still waiting for the basics. And that's what makes it so hard to accept. Because we live in a world of miracles. Cars drive themselves, AI writes essays, translates languages. Your phone knows your heartbeat before you do. And yet, despite all our knowledge and advances, we haven't solved the simplest, most urgent problem. Making sure a child in rural Ethiopia or a mother in Afghanistan can get antibiotics when they need them. Because healthcare, it's not a luxury. It's not a privilege. It is a right. And that is exactly what the United Nations Sustainable Development Goal 3 is about. Ensuring good health and well-being for everyone, everywhere. But today, according to the World Health Organization, half of the world doesn't have access to basic health care. Half of the world. That's not just a stat we scroll past. That's not a line in a report. That's 4.5 billion people. 4.5 billion stories, just like my grandmother's. And for 800 million of them, even when the care is available, they can't afford it. They spend at least 10% of their entire income just on medical expenses. Now I know, 10% may not sound like a lot, but when you earn barely enough to survive, 10% means an empty dining table. It means choosing between pain and poverty, between medicine and meals, between rent and survival. No one should have to make that choice. Not in 2025, not in our world with all the resources and potential we have. Let me show you what this gap really looks like. In Monaco, one of the wealthiest countries in the world, an average person lives to be 86. In Chad, one of the poorest countries, that number is reduced to 53. That's a 30-year gap. 3 decades, an entire lifetime gone. Not because of DNA, not because people in Chad are weaker or less deserving, but because of access. For millions of people around the world, that right is blocked by one thing above all else: lack of access. Access to clean water, to prenatal care, to safe childbirth, to basic treatments. These life-saving essentials that are expected, taken for granted in some places, are still out of reach for too many. The gap isn't just about medicine or technology. It's about whether people can actually get the care they need. We like to believe health is about choices. Eat better, work out more. But what if your hospital is 200 kilometers away? What if in your village there is one doctor for every 10,000 people? That's not just a statistic. That's the moral map of the world. And it shows us something painfully clear, that health outcomes are shaped far more by where you're from than who you are. It's not biology. It's borders. But here's what gives me hope. This gap, it's not permanent. It's not destiny. It's a challenge, one we can rise to. Remember COVID-19? A moment where the world stood still. But even in that stillness, something moved. Scientists in South Africa, researchers in Germany, doctors in Brazil, tech engineers in Singapore, all working, not in competition, but in collaboration. Sharing data, sending supplies. Social media became a lifeline, not just for updates, but for solidarity. And for once, we watched the world move fast. We saw what could happen when knowledge travels faster than the disease. But that speed, that connection, it didn't reach everyone. Take my grandmother, for example. She lived in a place where health data traveled slower than the disease, where hospitals were overwhelmed, where getting care wasn't just about having a doctor. It was about whether the system even saw you. But then came the pandemic, and we watched the world move fast. We saw vaccines getting developed in record time, not because we had better tools or fancy labs, but because we worked together, we connected. We watched the world developing into something, and that moment, it built a bridge between science and speed, between countries and communities, between what is and what could be. If we can do that in crisis, imagine what we could build in peace. We're entering a new era where medicine isn't just about treating an illness. It's about predicting it, preventing it. We've moved past science fiction. This is real, and it's happening now. But here's the question that keeps me up at night. Who gets this future? Who is this really for? Because technology alone won't fix inequality. It's not enough to upgrade machines. We need to upgrade mindsets. When I think about the future of medicine, I think of my grandmother. Maybe the best treatment wasn't within her reach, but maybe for millions like her, it can be. Because the future of medicine isn't just about technology. It's about humanity. It's about building a world where no one is left behind. Not because we can't reach them, but because we choose not to ignore them. And change is possible. Because the world isn't standing still. The World Health Organization has laid out a 20-year vision. It's not just a wish list. It's a roadmap backed up by real numbers and goals. By the end of 2025, they aim to provide essential healthcare to 1 billion more people. By 2045, they're pushing for a future where global health coverage isn't just an idea, it's a lived reality. A world where no one has to choose between rent and survival. A world where health is not just a luxury, it is a right. We are standing at crossroads. One path leads us to a future where access is unequal, where innovation is only for some. The other leads us to a future that we build together, one that's fair, compassionate, one that's human. It won't be easy, but it will be worth it. A future, because behind every statistic is a story. Behind every innovation is a life it could save. And if we dare to fight for that future, a future where your zip code doesn't determine your fate, where your passport doesn't determine your possibility, then maybe one day we won't just be telling stories of loss. We'll be telling stories of healing, of justice, of hope realized. That is the future I'm fighting for. And I hope you will too. Thank you.